I'd like to welcome you to this lecture on early brain development, why early intervention is critical to long-term mental health. It's every child's right to have optimal cognitive, social, and emotional behavioral development. Behavior is the manifestation of the brain, so what that means is that brain health needs to be maintained across the lifespan, and brain health really begins early in life. Medical practitioners have a stake in that, in ensuring that brain health is good across the lifespan. For us healthcare providers, whether we're obstetricians, family practitioners, or pediatricians, we care for the mother, the fetus, and the child, and we're concerned with the long-term mental health outcomes. And we do that by providing optimal environments, identifying risk factors either during the pregnancy or after the pregnancy with the child, through early diagnosis of problems, and then instituting early medical intervention and proper referral and coordination of services for the family. Now, as those of us who take care of children, and children are kind of the ones we're interested in here, it's important to realize that the time frame actually starts preconceptually. There's now good evidence that child mental health is dependent on the mom's health even before she becomes pregnant. And it certainly continues throughout the pediatric lifespan on through adolescence and into early adulthood. So the time frame is really quite large. And I just wanted to show you this slide from a recent review that talks about the effect of a maternal condition, in this case maternal obesity, on her offspring's mental health. So even before she is pregnant, the fact that a mom is obese can have an effect on the health of the developing fetus and then child. So, for example, in this slide we show excessive weight gain, risk of metabolic disease in the mom, affecting the pregnancy, intrauterine development, inflammation gets activated along with metabolic hormones, and that can impair brain development. So the time span that we're talking about really dates from conception through childhood. There's a lot of interest in early events and later outcomes. The whole field has developed around that. Wordsworth knew this back in the 1800s, and he said that the child is the father of the man. Now, in the more contemporary times, we refer to this as the developmental origins of health and disease. And initially, that concept that things that happen in the pediatric time frame affecting long-term health was applied mostly to cardiovascular disease, to risk of diabetes, hypertension, heart attacks, and so on. But we've really come to realize in the modern age that the same actors that are involved in giving the risk for heart disease also affect mental health. Development is really based on factors that are mutable, like experience, and also on things that are not as mutable, and that's genetics. And the intersection of the two, a field that's called epigenetics. So experience-dependent influences can affect how genes are expressed and therefore the functioning of the brain. The key to why early events affect later outcomes is that all organs, but especially the brain, are rapidly growing in the late fetal, early neonatal period, and really up to about the age of 3. I'm going to show you a diagram about that in a little while here. Any organ that is rapidly developing is highly vulnerable to insults. For example, disruption of nutrients that are important for brain development are going to be greater when the brain is rapidly developing, has a high need for those nutrients. Although it's highly vulnerable, it also demonstrates its greatest plasticity and resilience and response to therapy. And that's an area of great research right now. Events that happen to young children, babies, such as strokes and so on, babies show remarkable recovery from, much more than an adult does. And we would like to know very much about why is that possible. In general, though, I think we need to acknowledge that vulnerability outweighs plasticity, or stated another way, it's better to stay on developmental trajectory than to fall off trajectory and have to catch up. The cost to society is really in those long-term effects that I was describing. One could argue that if an altered environment early in life only caused a problem during that time period, in other words, caused acute dysfunction, but that after release from that altered environment, the child became back on trajectory, that would not be such a big thing. But there's plenty of evidence now that the altered environment early in life can affect the brain's structure and function well beyond the time of the deficiency, and that altered development causes adult dysfunction and adult dysregulation. And that includes regulation of genes that are involved in how the brain works. I'm going to give you a couple of examples here. For example, the cost to society of intrauterine growth restriction, so being small for gestational age, increases the adult cardiovascular risk by 25%. So just simply being a small baby at birth, less than 5 pounds at term, increases the risk of heart disease and reduces the IQ by about 7 points. Another example using micronutrients, eradicating the iron, zinc, and iodine deficiency around the world would increase the world's IQ by 10 points. And you can kind of ask yourself what you would do with an additional 10 points of IQ. So these are examples where early life problems, either nutritional problems or growth restriction problems, result in long-term risk to the brain. The basic principle, it's kind of the rules of engagement that we have, suggest that any positive or negative effects on early brain development are going to be based on 2 factors: timing and dose and duration. I know it looks like 3 factors, but dose and duration is really a single factor. Think of that as an area under the curve of exposure. And in our context of these lectures, environment would include nutrition, it would include exposure to stress, it would include nurturing events or enrichment, or combinations of the 3. The reason that timing is key is that the brain, we often refer to the brain having this problem or the brain having that problem, but the brain is not a homogeneous organ. It's actually made up of many, many different regions, all of which are on different developmental trajectories. So based on the timing, you can get different behavioral effects for a given type of injury. For example, the vulnerability of a brain region, let's say to a nutrient deficiency, is going to be dependent on 2 things. When that deficiency is likely to occur during the lifespan. I'll give you an example. Iron deficiency, which affects brain development, isn't equally likely to happen across the pediatric lifespan. There are certain times, the fetus, the toddler, the teenager, where iron deficiency is more likely to occur. At the same time, we've got to have the brain regions that are developing have a need for that nutrient. All right? So if iron deficiency occurs when a brain region doesn't have much need for iron, then there isn't going to be a long-term problem. On the other hand, if it occurs when the brain region has a very high requirement for iron, there will be long-term effects. And that principle stands for vulnerability to stress and also receptivity to enrichment. This schematic actually gives you a good idea of what I'm talking about. What we have here is a demonstration of brain development across the lifespan. I'm going to use my cursor here to show you that we start on this x-axis here well before birth, and we continue. And you can see how the x-axis has really been stretched here with months taking up quite a bit of the diagram, years being a little bit more compressed, and at the end over here, decades being highly compressed. And you can see these waves of brain activity happening here. Various areas, for example, the visual cortex and auditory cortex, the receptive and language areas, and even higher cognitive function mediated by the prefrontal cortex are all developing prenatally, there's birth, and throughout that first year, 2 years, and 3 years. And I've put a purple box around 0 to 3 to show you why prenatal and 0 to 3 interventions pay off. It's the time of most rapid brain development. It's the time when the brain is most receptive to positive stimuli, but also at greatest risk for negative. As we move out with the hatched lines here, you'll see there's less and less happening. It becomes more and more difficult to change the brain the older that the kid gets. So early neural development is important both immediately and later. In the early years, as we described, from the fetus through the first 3 years, it's really the development and sensitivity of early neural systems to extrinsic influences. And what we mean by early neural systems, we're talking about really the primary systems, learning and memory, mediated by areas like the hippocampus and striatum. Speed of processing, you might have noticed that myelination actually begins before birth and continues rapidly for the first 2 or 3 years. And the reward system, how we reward ourselves with our learning, the dopamine system, begins sometime in mid-gestation and has its peak activity through about 3 years of life in the human. The reason that's important is that later developing higher order neural systems, the ones that kids are going to need when they're in school, for example, the ability to multitask, the ability to have attention and inhibition, even though that's a later developing system, it relies on the integrity and the fidelity of the early developing systems. So the prefrontal cortex, for example, relies on initial connectivity from the hippocampus and striatum early in life, and examples where it's disrupted include prematurity, intrauterine growth restriction, newborn iron deficiency, all of which initially affect hippocampal and striatal structures, but ultimately end up with behaviors that are more based in the prefrontal cortex. It's also important to recognize that we need to scaffold such that maintenance, for example, Head Start programs, continue to work throughout development because of scaffolding on previously built systems. So what that suggests is that there's a coordination of the timing of interventions based on what we know about the biology. We know that different sensitive periods for the brain exist and that they are key in integrating interventions across these domains, whether we're talking about environmental stimuli like nutrition, reduction of toxic stress, or environmental enrichment. So the primary idea here is that there are sensitive time windows within which to provide integrated biological and psychosocial interventions to promote the development of children, particularly so that they can thrive in school. And yet, these occur in the early years before the child is school age. So an important thing to consider, who are the child's teachers early on? It's really the parents, and also when they interact with our system. So I just want to give some examples of each of the 3 domains. I'm not going to go into great detail on them because there are separate lectures on them. I want to show you first that there are all nutrients are important for early brain development, but there are nutrients that particularly affect early brain development and later adult function. And in this little table here, I've divided them up into macronutrients, micronutrients, and vitamins and cofactors that have been shown to either exhibit a critical or sensitive period for neurodevelopment. Those are marked with a 1. Ones that have shown that early deficiency results in long-term dysfunction, meaning in adulthood. Those are marked with number 2. And now with the new investigations in epigenetic mechanisms, some of these long-term effects have been shown to have epigenetic backgrounds to them. And you can see that with iron and with choline and with folate. So these are the critical nutrients that are important for the fetus, the newborn, and the infant and toddler to ensure good brain development. This is another way to look at that point. Here I've broken down the nutrients and their periods of particularly high brain demand. Some of them begin in gestation, others of them are a little bit later, and they may have global effects, they may have very specific effects on circuits, and they may have very specific effects on brain regions. There are 2 really nice recent studies that support that concept of sensitive periods for nutrient supplementation. For example, in a study that was done in Nepal, growth velocity, so the speed with which a baby is growing prior to the first year, but not afterwards, predicts the IQ at 9 years of age. Linear growth at birth and in the first year actually has a stronger association with weight gain. I think as pediatricians, we generally think about weight gain in children. Linear growth actually has a much closer relationship to brain development. So linear growth in that first year is important, but growth between 1 and 9 years, unless very severely stunted, does not have as much effect on IQ. When we look at micronutrients like iron and folate, Turns out that fetal supplementation of iron or folic acid improves working memory, inhibitory control, and fine motor 7 to 9 years later. But that same idea of supplementation during late infancy or toddlerhood does nothing. So critical periods that appear early in life that have long-term effects through nutrition. Again, we're going to have a complete lecture on stress, so I'm not going to go through this. You should know heading into these lectures that there's various forms of stress. There's positive stress, which comes from things like the exhilaration from a challenge that has a satisfying outcome. Tolerable stress, where you have adverse life events, but good social and emotional support to get you through it. And then toxic stress, which is exacerbated by chaos, abuse, neglect, and is identified with an unhealthy brain architecture. And I just want to concentrate on that point for a second. Bruce McEwen in New York has done wonderful work on the effect of stress on various parts of the brain. I had mentioned to you that the hippocampus is rapidly developing in late fetal and the first couple of years postnatally, and it is highly vulnerable to chronic stress. In fact, the hippocampus atrophies with chronic stress and chronic inflammation. And Bruce has shown that dendrites will shrink and synapses will disappear under toxic stress conditions. These effectors on brain development don't stand in isolation. In fact, they interact. And in this slide, I wanted to conceptualize nutrition, which was the first thing I talked about, and stress as a two-way model. In fact, your nutritional status does affect your stress response, and in turn, stress, through activation of pro-inflammatory cytokines and activation of cortisol, alters how nutrients are handled and alters the brain's growth. These factors, as we think about intervening, need to be considered as coordinated in terms of our interventions and not simply each of them in isolation. Finally, early enrichment. There's plenty of evidence for long-term impacts of early environmental interventions. Probably the most basic one from an intervention standpoint is that cochlear implants for hearing deficits have a maximal effect before the age of 3.5 years. From the attachment literature, we know that the latter half of the first year is a particularly sensitive period for promoting secure attachments, and that the early years of life are an important time period for interventions to improve quality of parenting. So it's really a two-way street in terms of the child and the parent in terms of that early environmental intervention. There are meta-analyses that show that intervention during early years have long-term cognitive and academic benefits, and that's particularly true if there are follow-up interventions to maintain the impacts of early interventions. So many social programs may emphasize 0 to 3, but there's clear data that one has to continue beyond that to maintain the effects. Indeed, for children receiving only a short duration of early intervention program, follow-up interventions during primary school stabilize those initial cognitive gains. It's particularly important for children who are at high cumulative developmental risk. So the higher the number of risk factors the child brings to the table, the more intense the early intervention and the longer that the follow-up should be in order to maintain the gains beyond the first 5 years. So what does this mean clinically? So clinically, we can actually start preconceptionally. I realize that most people that will be watching this series of lectures are actually taking care of children. But for example, family practitioners who take care of both the mother and the child will be interested in the clinical implications from preconception, during gestation, as well as postnatally. So preconceptionally, if we recognize that obesity is a problem not just for the mom who's about to become pregnant, but for her offspring as well, weight management in women of childbearing age becomes an important goal. Not only that, but your mom's nutrient sufficiency entering into the pregnancy influences the health of the pregnancy. 25 to 40% of women of childbearing age are iron deficient, and that's not just a problem in low and middle income countries, but in developed world as well. Moving on from the preconceptional period to gestation, there are several things, both nutritional and otherwise and medically, that need to be accounted for. Blood pressure control is probably the most important. 75% of babies who are small for dates, and remember I told you that that is a risk of about 7 IQ points to the child, 75% of that in the United States is due to maternal hypertension or preeclampsia during pregnancy. 10% of the population suffers from intrauterine growth restriction, and of them, they are all protein malnourished, and about 50% of them are iron deficient. Those are two critical nutrients for the developing brain. It turns out that being large for dates also is a risk to the brain. Being large for dates is usually due to diabetes during pregnancy, either pregestational or gestational. Turns out that 65% of large infants of diabetic mothers are iron deficient at birth. We should be concentrating on stress reduction. There's a very robust literature on the effect of maternal stress translating to fetal stress and abnormal fetal brain development. Weight management with reduction of obesity, because that's a pro-inflammatory state that will affect brain development. And finally, ensuring that moms are nutrient sufficient. They are getting their prenatal vitamins with iron, and that they are being supplemented with what are conventionally called the fish oils, the long-chain polyunsaturated fatty acids. Postnatally, we can improve or support our children's brain development first through nutrition, promoting breastfeeding being the most important of the bunch. Breastfed babies are smarter, they have less obesity, they have less infections, which in turn would affect how nutrients are processed. It's a clear advantage over formula-fed babies. If babies are going to be formula-fed, they should be given a formula that is supplemented with those long-chain polyunsaturated fatty acids. But that supplementation of formula-fed, of the formulas, does not substitute for all the other benefits of breast milk. One wants to, as a pediatrician or a family practitioner, ensure that we're maintaining iron and zinc sufficiency, and in certain areas of this country, and certainly in China, screening for thyroid status, which really means iodine nutritional status. We want to concentrate and learn how to screen for toxic stress. We recognize that toxic stress alters brain development, and it also alters how critical nutrients are accreted. And finally, we want to reduce infectious burden. Every time a child becomes infected, it activates stress responses, and it also alters how nutrients are handled. For example, during infection, iron is no longer available for brain development. So infection and inflammation interact with each other and alter brain development during critical periods of growth. So in summary, early environmental stimuli profoundly affect developing brain structures necessary for fundamental brain functions, learning and memory, speed of processing, emotional reward. Not only does it affect those primary structures, but those primary structures provide a neural scaffolding for later developing complex circuits that serve the higher cognitive functions. Early events, whether they are stress, nutrient deficiencies, whatever, they can confer a lifetime of risk through epigenetic modification of critical genes that are involved in synaptic efficacy. Synaptic efficacy meaning things that make your brain the efficient machine that it is. Now, many people ask the question, you mean it's all over with at the age of 3? And the answer is, of course not. But these early years are not the sole sensitive time period to influence brain development. But as I showed you on that schematic, that task gets a lot harder in later years if we don't have the proper scaffolding, if new stressors are introduced in later years, and most importantly, if follow-up of initial gains through programs are not maintained. In other words, there's a regression to the mean. So I hope that this has given you an overview on the healthcare perspective of development and why it's important to nurture that early brain through nutrition, reduction of toxic stress, and social enrichment. Thank you.